Magnesium quietly powers hundreds of biochemical processes throughout the body, yet many people fall short on it. Some estimates suggest the majority aren't meeting their needs. That gap sounds simple to fix, but here is the real concern. Using magnesium the wrong way can backfire. After combing through clinical research, I keep seeing the same avoidable errors. People start magnesium when it is not appropriate for them, or they mix it with medications that do not play nicely together, setting the stage for harmful interactions. The fallout is not trivial. Misuse can strain the kidneys, interfere with breathing, and in severe cases, disturb heart function. This video is your clear, no-nonsense guide to magnesium supplements. We will cover the benefits and the downsides, but most of all, the rules for safe use. When we are done, you will know exactly who stands to gain from supplementing, who should steer clear the right amounts to consider, and the red flags that require attention. So, let's get to it. The first step is not choosing a brand or a form. It is asking the right question. Do you personally need a magnesium supplement at all? Too many people take it on autopilot without confirming whether it fits their situation. Let's sort that out before anything else. Here are the unmistakable signals that your body may be running low on magnesium. The first big clue shows up in your muscles. Maybe you are drifting off to sleep when a stabbing calf cramp bolts you upright, or your eyelid keeps fluttering no matter what you try. Those episodes can be your body asking for magnesium. This mineral functions as a natural brake for the nervous system. When levels drop, nerve cells become overly reactive, like exposed wires that will not power down. The result can be cramping, twitching, numbness, and pins and needles sensations in the hands and feet. It does not stop with cramps either. If your legs feel unsteady during a walk, or your strength is not what it used to be, magnesium may be part of the story. Muscles rely on it to produce usable energy, and when it is lacking, they simply cannot tap the fuel they need to perform. The second major indicator lies in how you handle stress and mood. Stress does not live only in your thoughts. It actively drains the body's magnesium reserves that sets up a loop many people never recognize. In fight or flight mode, the sympathetic nervous system revs high, and your need for magnesium climbs. At the same time, stress hormones like cortisol and adrenaline nudge the kidneys to spill more magnesium into the urine. Stress consumes it, and low magnesium magnifies stress, like sinking deeper the more you struggle. If anxiety flares easily, irritability lingers, or your mind races at bedtime while sleep slips away, magnesium could be the missing piece that breaks the cycle. The third group that particularly benefits from magnesium is older adults. With age, the digestive system loses some efficiency. Stomach acid production declines, so magnesium in foods does not dissolve as readily, and the intestines become less effective at pulling nutrients across into the bloodstream. Even when magnesium dissolves, less of it ultimately gets absorbed. Diet plays a role too. Many seniors eat fewer magnesium-rich staples like leafy greens, whole grains, and nuts, whether because these foods are tougher to chew and digest or because appetite has decreased. That combination of reduced intake and impaired absorption makes low magnesium strikingly common after age 60. If you live with digestive conditions such as acid reflux, irritable bowel syndrome, or inflammatory bowel disease, your risk rises further, since these issues can disrupt proper nutrient absorption. The fourth group includes people who use certain everyday medications. Diuretics prescribed for high blood pressure or heart conditions increase urine output, and along with extra water, they carry magnesium out of the body, setting the stage for deficiency. Acid-suppressing drugs, known as proton pump inhibitors, have a similar downstream effect for a different reason. If you take medicines like omeprazole for heartburn or ulcers, you lower the stomach acid needed to absorb magnesium effectively. Over time, even a diet that contains magnesium-rich foods may not prevent levels from slipping if these medications remain in the picture. The fifth group that frequently benefits from added magnesium is people living with diabetes. Here is why. When blood glucose runs high, the kidneys work harder to clear the excess sugar in the urine, and magnesium gets carried out with it. Insulin adds another twist. It does not only shuttle glucose into cells, It also draws magnesium inward, which can temporarily lower the level circulating in your blood. Because magnesium is essential for insulin to function well, a shortfall can further undermine glucose control, creating yet another feedback loop. There is an important caution, though. If diabetic kidney disease is present, impaired kidneys may struggle to clear excess magnesium, making supplementation risky. In that case, medical guidance is essential before taking any extra. Regular alcohol use is another drain on magnesium. Alcohol hinders absorption in the gut and increases urinary losses, so even moderate intake can slowly chip away at your stores. People who train hard or work in heat face similar losses from a different route. Heavy sweating moves significant amounts of magnesium out through the skin, so athletes, construction workers, and anyone who sweats heavily day after day can end up short. Magnesium can also matter for those with elevated blood pressure. It acts like a natural relaxant for the smooth muscle and blood vessel walls. When arteries and veins are less tense, blood flows more freely and overall pressure can ease. Only many people in industrialized nations have another reason to consider their intake. Modern agricultural practices have lowered the magnesium content of soils, so today's foods often contain less magnesium than comparable foods did decades ago. If your meals rarely feature dark leafy greens, whole grains, nuts, seeds, and beans, it is likely that food alone is not supplying enough magnesium. For most adults, a daily intake of 100 to 200 milligars of magnesium is typically safe and helpful. If you are showing signs of low magnesium, a higher amount may be appropriate, but do not go over 305 mg per day from supplements unless a healthcare professional is directing your care. Not every magnesium supplement delivers the same results. Magnesium glycinate and magnesium malate are well absorbed and usually easy on the stomach. By contrast, magnesium oxide is best reserved for constipation relief. It is absorbed poorly and behaves more like a laxative than a true nutritional supplement. Who should avoid magnesium altogether? Some people should not use magnesium supplements. The foremost group is anyone with impaired kidney function. Healthy kidneys clear excess magnesium from the bloodstream. When they do not work well, magnesium can accumulate to toxic levels, a condition known as hypermagnesemia. Early toxicity often brings nausea, vomiting, and diarrhea. If levels keep climbing, symptoms can progress to muscle weakness, low blood pressure, breathing difficult, and irregular heart rhythms. At the most severe end, the heart can stop. Consider Susan, age 72, who had mild kidney disease and persistent constipation. She saw recommendations online and started a magnesium supplement, not realizing her kidneys could not eliminate it efficiently. After only 5 days, she felt unusually fatigued and nauseated, assuming a flu was coming on. Her daughter took her to the clinic, where tests showed dangerously high magnesium. Margaret required hospitalization to clear the excess from her system. The takeaway is clear. If you have any degree of kidney disease or kidney failure, do not take magnesium supplements without direct medical supervision. The second group includes people with chronically low blood pressure, because magnesium relaxes blood vessel walls and naturally lowers blood pressure further. If you already live with hypotension, adding magnesium can push readings into a dangerous range, provoking lightheadedness, fainting, or falls, which is especially hazardous for older adults. Consider Robert, a 69-year-old retiree whose blood pressure tended to run low. After hearing that magnesium might ease muscle cramps, he began a supplement. On the third day, he stood up from his morning coffee and the room began to spin. He steadied himself on the kitchen counter to avoid falling. When his wife checked his pressure, it read 85/55, a perilously low value. They phoned his physician, mentioned the new supplement, and were told to stop it immediately. Within 2 days, Robert's pressure returned to his usual range and the dizzy spells resolved. The third group consists of people with a slow heart rate or existing rhythm disorders. If you have bradycardia or a condition known as the heart block, magnesium can aggravate the problem. By further slowing the heart's electrical conduction, supplementation may precipitate serious arrhythmias and, in extreme situations, even cardiac arrest. Consider Frank, age 75, whose resting pulse naturally hovered around 55 beats per minute. His physician was keeping an eye on it, but no treatment was needed. After reading that magnesium might improve sleep, Frank began taking a supplement. Within a week, he felt unusually weak on his daily walks. At his routine appointment, his heart rate had fallen to 42 beats per minute. The added magnesium was pushing an already slow rhythm even slower. His doctor stopped the supplement immediately, and over time, Frank's pulse returned to his usual baseline. The fourth category is people taking specific medications. Magnesium can interact powerfully with several drug classes. With certain antibiotics, particularly tetracyclines and fluoroquinolones, magnesium binds the drug in the stomach and prevents it from being absorbed, blunting the antibiotic's effect. Doses should be spaced at least 2 hours apart. Linda's experience shows how easily this gets missed. She was treated for a urinary tract infection and had been swallowing her morning magnesium with breakfast for months. Unaware of the conflict, she completed the full antibiotic course only to find the infection persisting. When the pharmacist reviewed her supplements, the absorption blockade from magnesium was obvious. There are other pairings to handle cautiously. Combining magnesium with prescription muscle relaxants can compound their effects, pushing blood pressure and heart rate too low. Cardiac glycosides used in heart failure, such as digoxin, pose a different challenge. Magnesium can alter how these medicines are absorbed and handled in the body, weakening their effect or making their action unpredictable, and that unpredictability can raise the risk of rhythm disturbances. Consider Dorothy, 81, long stable on digoxin, with routine blood monitoring. After she added magnesium for leg cramps, her digoxin levels began swinging some days below, target other days above. Her cardiologist spent weeks retitrating therapy until the interaction was identified. Once the timing of magnesium and her heart medicine was coordinated correctly, her levels stabilized again. Let's lay out the non-negotiables for using magnesium safely and effectively. Start with vitamin D. Magnesium is required for vitamin D metabolism, but very large vitamin D intakes anything above 4,000 IU per day can drain your magnesium reserves. If you are on high-dose vitamin D, ensure your magnesium intake is adequate, while remembering that piling on ever larger doses is not the goal. Next, know the limits of lab testing. Only about 1% of total body magnesium circulates in the bloodstream. The rest sits inside bones, muscles, and cells. Your body tightly regulates serum levels, which means a normal blood result can coexist with widespread tissue deficiency. Do not lean on a single blood test as the whole story. Pay attention to clinical signals such as muscle twitching, weakness, numbness, or tingling in the hands and feet, heart flutters, anxiety, poor sleep, and fatigue. Keep the calcium-magnesium relationship in balance. Taking calcium without magnesium invites trouble. In the absence of sufficient magnesium, excess calcium can settle in the wrong places, contributing to kidney stones and arterial stiffening. A practical rule of thumb is a 2-to-1 ratio of calcium to magnesium. Also account for caffeine and alcohol. Both increase urinary losses of magnesium. If coffee is a daily habit or you regularly drink alcohol, consistency with magnesium intake matters even more to offset those losses. Finally, avoid swallowing large doses on an empty stomach. That is a reliable way to provoke diarrhea, cramping, and nausea. Divide the total into smaller amounts taken with meals instead. Spreading the dose not only minimizes side effects, it can also improve overall absorption. Start magnesium the right way by easing in. Begin with a low 100 mg dose taken at dinner, so you can see how your body responds without upsetting your digestion. If a week passes without issues, step up to 200 mg per day and split it into 2 smaller servings, one in the morning and one in the evening. Prioritize forms that absorb well and are gentle on the stomach, such as magnesium glycinate or magnesium malate. Pair each dose with a meal that includes some healthy fats to support uptake, and avoid taking it alongside very high-fiber foods or drinks, which can hinder absorption. Keep perspective too. Magnesium works best as part of an overall healthy routine, No capsule can cancel out a diet heavy in processed foods, excess sugar, or unrelenting stress. Treat magnesium as a valuable piece of your wellness plan, not a cure-all. Now, it's your turn. Have you noticed any of the warning signs we covered, or are you unsure whether magnesium is a good fit for your situation? Tell us about your experiences and questions in the comments. If this video helped you understand magnesium and steer clear of serious mistakes, please tap, share it with friends and family, and subscribe to Better Life. We are dedicated to bringing you science-based health guidance that is practical, safe, and easy to apply.